The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. I'm Tony Urbanek, and this is TMD Demystified. And for any newcomers, I would encourage you to review earlier episodes to give you a little handle and a little background on the entire process of this podcast. But today we're going to talk about what I feel is a very interesting topic. Definitely, I find it interesting, and that is the patient's observed reaction along their treatment, their diagnosis, consultation, and treatment. It's very fascinating. And any of you who treat a number of TMD patients, some of these things I'm about ready to share with you are going to be meaningful. You observed them. And those who are just getting started, you have a lot to learn. But it's all very interesting. And again, this is a huge problem. We're talking about roughly 45% of females have some kind of symptoms associated with TMD. Not all of them severe, for sure, but many of them are life devastating. Many. We don't know how many. I can't put a number on that right now. But because of that, because it is such a large problem, which is undertreated, not understood, misdiagnosed tremendously, I can prove that. You have a subset of patients who come to you for treatment, however they get to you, that along with their need to fix their symptoms, we won't go through that again, they bring with them their emotions, their reactions, and their expectations. The personal side of this, the human side of this. The reason that hopefully we all became doctors of one kind or another to help people. And believe me, whatever your background is and whatever your usual treatment, where you come from, general dentistry or oral surgery or orthodontics, your methods of treatment, but you yourself have run into patients who bring with them their emotions, reactions, and expectations. And TMD is no different, except it's magnified tremendously in some cases. And I want to share my experiences, my knowledge about this a little bit. Hopefully it'll help some of you understand what this is all about when it comes to treating patients. Some of you will reinforce what you've already been seeing. Some of you will give you information that you can use when you see patients and you yourself aren't triggered to react in some unusual way because of what you're seeing sitting there in the chair, that sometimes can throw you. And I can't say I've seen it all. I don't know whether I'm ever going to see it all, but I've seen 99% after doing consults and treatments for upwards of now 5,000 patients in the past 7 years. 5,000 patients in 7 years, all with TMD symptoms, verified diagnosis, and all the clinical parts, the technical parts, they're all fit. But what isn't discussed very much, and what is important to discuss and understand if you're going to treat these patients, so that you don't misstep and you don't create a problem for yourself, and that you create what I just prefer to call understanding with the patient. These are not difficult patients. All right. Point one. So we're going to call this episode TMD Patient Emotion, Reactions, and Expectations. Point one is that as I got deeper and deeper into this, and my colleagues found out that I did kind of focused on temporomandibular joint problems, several of them made comments similar to this. Tony, why do you want to focus on these patients? You know they're all crazy. And I have heard that. Maybe you have heard that. Maybe you think that. Maybe you surmise that. But I want to make it really clear, as a group, as a whole group, the TMD patient are not crazy. They have been one way or another, by their own missteps, by the missteps of the professions, been abused to try to get to where they're going, which is relief of their symptoms. Patients don't know anything about dentistry or medicine. That's kind of a hard thing to get your hands around when we know so much and we're technically qualified and schooled, and our life revolves around all these technical issues. And sometimes we get going and we think patients know a lot more than we think they know. And the vast majority of them know very little, even though they spend a lot of time looking at Dr. Google on the internet. But getting back to the point, these patients are not crazy. Many of them are crazy with pain. Many of them are crazy with absolute frustration. And then the frustration brings on other problems, one of them being absolute skepticism about anybody that's trying to help them or see them or offers them help. I did 2 separate episodes on skepticism. I'm not going to repeat those, but I refer you back to those episodes if you want to hear what I have to say about patient skepticism and skepticism about TMD in general. Back to the patient's emotions, reactions, and expectations. Let's just talk real about this. Is when you see these patients in your office, and you will go through the usual steps of a consultation steps. There's episodes on that, what the steps are. And then once you get them into treatment, the check appointments, what happens then, and then the follow-up check appointments, and then finally your final check appointment, or when you're ready to discharge a patient. And actually, in my practice, I don't ever tell a patient they are discharged if they have TMD. I make it really clear that if they have problems in the future, similar symptoms, similar going on, that I'm happy to see them. I see very few people back. The majority of people I see back are people who lose or break the device. There's 1 or 2 or 3 a week now that come in and they've lost, broken, or the dog chewed up the device. I see a lot of those. I see a few people that have worn the device for 5 or more years that get into additional symptoms because they're not following the protocol. That is fairly common. I mean, even to the point where they come in, they have more symptoms, and I say, how you doing? Are you wearing your device every night? And they go, well, no, I'm just having more symptoms. It's like, well, you got to wear the device every night. I mean, that's the whole point. Once we get you comfortable. On the other hand, there are a few people that come in with additional symptoms, and there are times when we have to adjust the device or even remake the device because the vertical dimension isn't correct, technical things like that. But getting back to the patient's emotions, reactions, and expectations. Well, let's take it a step at a time. What do you see at consultation? That's when you first introduce yourself and get the patient's name, and start to gather the symptoms. And again, there's a full episode on exactly how you do that. But what do you see sitting in your chair? What are the patient's emotions? Now, there is no typical TMD patient. There isn't. I can't describe it for you. There's no typical TMD patient. There is no typical person. Everybody is different. When you really sit down, take the wide viewpoint, the 100-mile viewpoint of a patient when you're sitting there. If you do it enough, you'll obviously see, patients have some similarities, but there are no patients that are alike. Everybody is I see is significantly different in their beingness, in their personality, if you want to call it, in their own presentation. But as far as the emotions, the reactions and expectations, you see some similar things. Number one, try to categorize this a little bit. And the one that comes to my mind first is the patient who has been run around in circles for years, no exaggeration. And the majority of our patients that we see have been one way or another running around in circles for years. The years might be 3 years, which is not very often. Usually it runs 5, 10, 20, 30 years where they have had these symptoms and they've seen multiple doctors for the symptoms. And maybe they go to one doctor for one symptom and another doctor for another symptom. It's been misdiagnosed. It's been called earaches. It's been called, it's ear infections, dental problems. It's been called all kind of things, or shake the head, I don't know what it is. We've talked before about the physicians. Some physicians have no back off in telling a patient, I think you're crazy. When you get all these disparate symptoms that go from the top of the head all the way to the tip of the fingers, causing, pain, discomfort, and patients gives the doctor that litany of these symptoms that come and go. They're not constant. And the physician looks and says, I've heard it multiple times. My doctor said I'm crazy. Dentists don't say that. But those patients who come in with that high degree of frustration, you can tell. You can see it right in their eyes. You just watch their face as you gather their history. Let them talk first. As you gather their history, you can see their emotions attached to it. And as you then question them about further symptoms, you can see their response, and you can see how frustrated they can be, angry. Some of them, they're there because someone has told them that going to us, in this case, our office, our clinic, our practice, will solve that problem for them. And I've seen people sitting in the chair that are absolutely angry because they've been told that multiple times. You have to be empathetic. Sympathetic, maybe not, but at least empathetic in the situation that they have. Very important. Because they're crazy with pain and they're crazy with frustration, and they don't know what to do. They don't know the technical aspect, even what questions to ask, and they're sitting in front of a professional who claims he has or claims he may have the solution, and they just total frustration. So that's the big one. And you have to understand that when you sit in front of these patients, and don't take it personally. That's the next thing. Just absolutely don't take it personally. Once you, as a professional who are experienced enough using the technology that we treat, the device and protocol, that's the technology, and you see it work enough times, and it is predictable enough times, then you, as the professional, can sit back in the chair and know that once you make appropriate diagnosis, you share what the diagnosis is, TMD, you know that you can help them. And then it is your job to get those patients through the stops and barriers that they have so that they can accept treatment. They want the solution. They're not sure what the solution is. And then, of course, you're sitting there offering them a solution with certainty that you can help them. I'm certain when I'm talking to a patient, if they have TMD, I know we can make the symptoms go away. I'm certain of it. We've done it enough times. They're not certain. And so you'll see reactions of skepticism, sometimes anger. But that's what you will see in the patients who have been run around the block for years on this. And then the other kind of patient, kind of category that comes in is a patient that's kind of new to TMD. Now, this can be a mom and a daughter. Daughter's 15, 16 years old, which is really common to see 15, 16-year-old female sitting in your chair with mom sitting in the corner, and female adolescent has started to have headaches, earaches, jaw pain, on and off constantly. And finally somebody says, I think after a couple trips to the ENT doctor, maybe a neurosurgeon, neurologist, somebody says, I think this might be, or their dentist, I think this might be TMD, and go see Dr. Urbanik. So that's another category that doesn't have the frustration because they haven't been run around in circles for years. But then there's the skepticism that this little device and the description of how it works is going to be successful. And again, you are not, if you haven't done this enough times, you're not going to be certain of it. But at some point, after you've done, I don't know how many cases, so, 10 cases, 40 cases, 50 cases, certainly by that time, you go, oh, I see, as the physician, as a practitioner, I see this really works. So, but the point being that what you see is, mom and daughter, or the younger person, or maybe the middle-aged person reaching out for help, but they haven't had these symptoms a long time. It's important for you to describe the process, and I hope, the TMD in general, what the symptoms are, what they can expect, what their history has been, and what they can expect in the future. Because as we all know, people with TMD, it just doesn't magically go away over time. It does not happen. They increase symptoms, they increase the degree of symptoms they have, the degree of pain, the degree of tinnitus, the degree of vertigo. The symptoms only increase. They don't decrease spontaneously. It does not happen. So, but the reactions you see and the expectations, in that case, it's mostly about expectations that the patients have. It's like, you're not going to give me a pill. You don't have, surgery is not the answer. I don't have to do surgery anymore. Surgery is definitely not the answer for this problem. That's been covered multiple times, multiple ways. But the expectations of the patient is, a lot of times they want something quick and fast. We all know, or if you don't know, I'm going to remind you, there are three, quote, I don't like the word conservative, because you can be non-conservative using anything, including aspirin. It can be non-conservative. You can tear up your liver and your kidneys, self-medicating. But the point is that there are three things that are helpful to TMD early on, which is non-steroidals, Motrin, Tylenol, or aspirin, which pretty much everybody that comes to see us has already exceeded the usual and customary amount of that. They take it for 2 or 3 weeks, doesn't work anymore, and all it does tear up their stomach. Second thing is, it's common sense. If your jaw's hurting, you got pain up here, you think it's having to do with the temporomandibular joint, you go on a soft diet. Pretty much everybody has already done that. And the third thing is on and off heat, not ice, not sleep on and off heat. 10 minutes on or off, 10 minutes on. What all three of those things will do is decrease inflammation. Just think about it. That's what they do. They decrease inflammation. And where does the pain come from? Where is it generated from? What's the origin of the pain? Inflammation in the joint, not the position of the disc. But that's another story on a different episode. Again, we're talking about expectations now. So it's a humanistic thing you do. You almost you're not there to be a psychologist. You don't have to understand them psychologically. That is not what I'm portraying here. It's not what I'm suggesting. What I'm suggesting is you need to kind of just sit back from a wide viewpoint and understand where these emotions come from, where the expectations are coming from, and adjust your presentation, adjust yourself, so that you give that patient the best opportunity to get treatment. And some people, no matter how well you try to do that, no matter how much you're interested in trying to help them, they will not hit the ball. I mean, they'll walk out and, think that doesn't make any sense to me. It's your job to make sense to the patient. It's your job to portray what you have to offer is viable and that it is effective if you want to help the patients. All right, so that's kind of what I have to say about the consultation part of this. Now, this is where it kind of gets more fun. The consultation can go multiple ways, and the personality you have in the chair of the patient or the patient's husband or the patient's mother, that it's hard to quantify and qualify. But the delivery part is very easy to do. It's very fast. I mean, I can do a delivery in 5 or 10 minutes. But the point is delivery, the emotions that the patients see. I walk in the room and I say, "How you doing, Janie? Good seeing you again. We got your device for you and we're going to get you fixed up." And I list out the symptoms again. I look at my chart, I'm holding my chart and I look at the symptoms. I said, "So these are the symptoms that you gave us at consultation. Does that sound like you?" And they say, "Yeah, they all shake their head. Yeah, that's me." I said, "I want you to think simple about this. And this is not a complicated thing." And I heard it yesterday. I heard this comment and I hear it frequently. I mean, once a week, maybe once every 10 days, or sometimes a couple times a day. It's like, "I'm so excited." These are the patients, they say, "I'm so excited." These are the patients who have had long-term pain and they've done this or that, been recommended this or that. And they've been I won't go through, they've just been run around the circle and multiple times. And, the way our history and our practice, how we're thought of here in Middle Tennessee, the patients know that they're going to get relief. And I love to hear it. They say, "I'm so excited." I heard that yesterday. And I know what they're excited about. They're excited that now they're going to start getting relief. That's a nice thing. That's a really good experience to have when you have the opportunity. I missed something about the diagnosis. Let's double back to the diagnosis appointment a little bit. You will see this, and it's the most interesting phenomenon. First time I saw it, it really had an effect on me. So when you describe the patient's symptoms, and I emphasize that as you do a diagnosis, that you should go down the entire list of the patient's symptoms, most of which they don't know have been coming from the temporomandibular joint. And then they have this epiphany. "Do you mean my shoulder pain? Or do you mean my headaches are associated with this pain I'm having in my ear?" We go through that kind of thing. And at some point, the patient will get very teary-eyed, very, very emotional, and to start to cry, literally. And I've seen this multiple times. And I always have a set of, box of Kleenex at hand. And I just silently pick up the box of Kleenex, I hand it to the patient, and I just kind of delay my comment for a moment or two. And finally, I say something like, "Are you all right?" And their response is always similar. It's like, I'm so happy, tears of happiness, because what they know that you know about this problem, and they know now, as you have gone through your knowledge of this problem in front of them, they know that you are qualified to help them. And many patients give it, I don't think I've seen a man do it, but I've seen a lot of females do it. They just tear up and they just cry for a while. just the thought, I mean, they haven't had any pain relief at all. Just the thought that there is someone who can help them, that there is something that can help them, something that will take away their constant, painful, life-changing symptoms. So get ready for that. And that's the first time I saw that. You know, after the first few times, I'm ready for it now, but it choked me up. Definitely choked me up first time I saw that. All right, let's get on. So we've covered the consultation, the delivery of the device itself, emotions, reactions, and expectations. Let's go on to the first time they come back for a check. It can run all over the place, but the point I want to make about that is, you know, I walk in the room, I say, you know, Annie, how you doing? It's 3 weeks now since you've had the device. Have you kept it in 24/7 like I asked? And pretty much everybody will go, yes. Few people will go, well, no, I haven't. Well, we won't talk about that. Let's talk about the people who go, shake their head, yes, sir. That's what I've done. Point one, you cannot gauge the emotion of the patients just by looking at them. Doesn't happen. It's like the patient sitting in front of you after 3 weeks can have a range of anywhere between 10 or 20% of the symptoms are diminished or gone, or 100%. But I steeled myself a long time ago from having expectations as to whether or not they're going to have a smile on their face, or that they're going to be jumping for joy. It doesn't happen. But when you ask them what percentage of the overall symptoms are diminished or gone, then they'll start to smile. If they have, you know, significant 40, 50, 70, the average is 70 at 3 weeks, % of their symptoms are gone. The ones that really throw you, I had one, I believe it was yesterday or the day before, a patient walked in and asked her the key question, take all the symptoms, lump them together, average it all out. What percentage of your symptoms diminished or gone? And she said 100%, and without a crack and a smile. And it's like, I always do the high five when they do that. When I get somebody that says 80, 90, 100% at 3 weeks, plenty of those. And I give them, you know, I give them a high five. And sometimes I'll even say, how come you're not smiling? I said, this should, you know, and then they'll loosen up a little bit. I think it's the doctor. I think, obviously, my opinion is, I think doctor intimidation, you know, one way or another, there's, you know, most people are intimidated by doctors. So they just, they're not as familiar. They don't speak in the familiar like you and I would speak to one another, or they would speak to their family members. There's nothing familiar about it. It's like they're kind of intimidated by the location, intimidated by you being a doctor. But don't let it throw you, because in that case, a lot of these people will have a lot more happy emotions than they're going to show. And then when you get into it, you know, you can get them to smile, and they'll tell you, you know, that they're doing better, or they're doing extremely well, or they're doing fantastic. And the ones that you hear up and down the line, it can be at 3 weeks, it can be at 2 months, it can be at 4 months, it can be a discharge. And those are the patients who look at you in the eyes and say, you have changed my life. You have changed my life. And that is certainly an emotional reaction and response that changes your life as a physician, when you know you're doing that. So, and then, you know, the second check, which happens at 2 months, you know, they'll come in at any varied point, at any check, they can say anywhere between a low number would be 20%, and a high number would be 100%. And the average number at 4 months is, average number at 2 months is 84% of the symptoms are gone. Averaged out, we did a study. But they won't, you can't tell it by their face. And you can get them to talk about it. Once they start talking about it, then they'll be more familial with their conversation and lighten up about it. Won't be so serious. It kind of amazed me. I mean, patients like 100% of my symptoms are gone. They're not bouncing off the wall, but they are. But when you get to talk with them, yeah, they will be really, really happy, and they'll make very, very good comments about what you're doing, what's going on. And that's kind of what you expect with the TMD patients as you sit in an office. And the reason I bring this up as an episode when TMD Demystified is I never, ever saw this as a surgeon. I mean, I had patients make good comments, negative comments, neutral comments. But as a surgeon, as an oral maxillofacial surgeon, whether I'm doing huge reconstructive procedures on the face, trauma, or office surgery, traditional dental implants, extractions, and third molar removal. I never saw that kind of response from patients that I'm describing for you now with regard to TMD patients. TMD patients, they are, if you're going to put them in a category, they are much more emotionally attuned to their emotions, reactions, and expectations because of the nature of the problem. It's a chronic thing. They can't get it to go away. It appears nobody else knows what to do. They're told multiple ways at times. Doctors just roll their eyes and say, I can't help you. I've heard that so many times. Dr. So-and-so, he just said he couldn't help me. So it creates unusual, let's just say unusual kinds of emotions, reactions, and expectations from the patients. So got to learn to enjoy it, learn to deal with it, and learn to understand it. What you're looking at, what you see is not unusual. What I talked about today, and I probably missed a few. I don't want to drone on about this a whole lot longer. There are many reactions, but the ones that stick out in my mind and the ones that you kind of need to know about, be ready for these things, because they're usual. I mean, you see them not infrequently, and it's good for you, the practitioner who treats this problem successfully, to understand what you're looking at, why you're looking at it, and deal with it for your own benefit in your own mental health, because it's a wonderful thing to be able to help this group of individuals who, for the most part, in our society at this time, they have not had the opportunity to have successful treatment. That's what I have to say today. And as usual, I encourage comments and even criticisms. I'm available to talk with you on any topic regarding TMD at any time. You can reach me at tony@tmjservices.net. Our Director of Marketing and Education, Naomi, is always available at naomi@tmjservices.net. And until next time, I look forward to speaking with you again on the next topic. This is TMD Demystified.